You'd never expect your daily bathroom routine to be linked to something as serious as a stroke. But for many older adults, small habits, often dismissed as harmless, can quietly raise the risk. Today, we're shining a light on 4 common but overlooked bathroom behaviors that may increase stroke risk by as much as 200%. If you're over 60, this could be the most important health video you'll watch today. Let's begin. 1. Straining during bowel movements, a hidden danger that raises stroke risk. It's a topic most people shy away from, uncomfortable, private, maybe even a little embarrassing. But here's the truth. What happens in the bathroom, particularly when it comes to bowel movements, could have serious implications for your heart and brain health. And one of the most dangerous habits? Straining during bowel movements. Now let's break this down gently but clearly. As we age, constipation becomes more common. Our digestive systems slow down, physical activity tends to decrease, and many older adults take medications, like painkillers, calcium channel blockers, or iron supplements, that can contribute to harder stools. So the natural response for many is to push harder, hold their breath, and try to force it out. But this effort isn't harmless. What many people don't realize is that straining on the toilet can cause sudden spikes in blood pressure, specifically, something called the Valsalva maneuver. That's the act of holding your breath and bearing down, like when you lift something heavy or push during a bowel movement. While this technique can help force stool through, it comes at a price. It drastically increases intra-abdominal pressure and blood pressure, especially in the arteries leading to the brain. And for someone who already has high blood pressure, fragile blood vessels, or underlying cardiovascular issues, a combination common in people over 60, this sudden surge can lead to a ruptured blood vessel in the brain or trigger a blood clot, both of which can cause a stroke. In fact, studies have shown that some strokes, particularly hemorrhagic strokes, have occurred in the bathroom precisely because of this. In Japan, where bathing and toilet habits are carefully studied among aging populations, researchers found a spike in stroke incidents linked to toilet strain, especially in the early morning hours when blood pressure naturally peaks. Even more startling? Some stroke cases that happen while using the bathroom go unnoticed until it's too late, because the symptoms are mistakenly blamed on dizziness or exhaustion. That's why awareness is so crucial. But here's the hopeful part. This is something you can change starting today. If you find yourself straining often, the first step is to rethink your approach to bathroom health. Here are a few simple but powerful ways to reduce your risk. Stay hydrated. Dehydration is one of the most overlooked causes of constipation. As we age, our sense of thirst diminishes, so many seniors don't drink enough water. Make it a habit to sip throughout the day, even if you're not thirsty. Aim for at least 6 to 8 cups of water daily, unless otherwise advised by your doctor. Eat more fiber. Soluble fiber adds moisture to your stool and keeps things moving. Oats, flaxseed, chia seeds, lentils, beans, and leafy greens are great options. If chewing is an issue, try warm soups, smoothies, or oatmeal bowls that are soft but rich in nutrients. Move your body. You don't have to run a marathon. Just 15 to 30 minutes of daily walking can stimulate digestion and help prevent constipation. Think of it as motion for your digestion. Use a footstool when sitting on the toilet. This mimics a natural squatting position, which aligns your body in a way that makes bowel movements easier and reduces strain. It's a small change that makes a big difference. Don't delay the urge. Waiting too long to use the restroom allows your colon to absorb more water from the stool, making it harder and more difficult to pass. Go when you feel the urge. Don't put it off. Review your medications. If constipation is persistent, speak with your doctor about your prescriptions. There may be alternative medications or adjustments that can reduce the side effect. Practice breathing and relaxation. When you sit down on the toilet, try to relax your body. Deep, slow breathing helps reduce tension and lowers your blood pressure response. Never hold your breath or push hard. Allow your body to do what it needs, gently and patiently. Remember, stroke prevention doesn't always come from big surgeries or expensive tests. Sometimes it starts with something as quiet and overlooked as how you use the bathroom. So the next time you find yourself on the toilet, take a breath. Be gentle with your body. Don't rush. Don't strain. Because protecting your brain starts with protecting these small, private moments that most of us never think twice about. 2. Spending too long in the bathroom when quiet time turns risky. At first glance, spending extra time in the bathroom might seem like no big deal. In fact, for many older adults, it's one of the few quiet, uninterrupted moments of the day, a place to read, reflect, or simply rest. But here's the hidden truth. Spending too long sitting on the toilet can silently increase your stroke risk, especially if it's part of your daily routine. Let's unpack why. When you sit on a toilet, your body is positioned in a way that can restrict blood flow, particularly in the lower half of your body. The longer you stay there, the more pressure builds in your veins and arteries. For older adults, especially those with circulation issues, diabetes, or high blood pressure, this can quickly become dangerous. You may not feel it immediately, but over time, this extended pressure can cause a drop in blood returning to the heart, triggering a temporary blood pressure fluctuation, especially when standing up afterward. That sudden shift from sitting for a long time to standing quickly can result in orthostatic hypotension, a sudden drop in blood pressure that may cause lightheadedness, dizziness, or even a fall. But here's where it gets even more serious. For individuals with a history of vascular issues, this change can affect blood flow to the brain. In rare but well-documented cases, such episodes can contribute to ischemic events, where parts of the brain don't get enough oxygen. And if clots are present in the arteries or the blood pressure fluctuates too severely, this can lead to a stroke. So why do people stay so long in the bathroom in the first place? For many, it's not about a physical need, it's about habit. The bathroom becomes a quiet retreat, a spot to scroll through a phone, read a magazine, or just take a break. But this well-intentioned downtime could be costing your health more than you realize. Here are some subtle signs that your bathroom time may be doing more harm than good. You regularly spend 15, 20, or even 30 minutes sitting on the toilet. You use your phone or read while seated, losing track of time. You sometimes feel lightheaded or dizzy after standing up. You associate bathroom time with emotional escape or stress relief. These might seem minor, but over time, they become a pattern. And when you're over 60, even small disruptions to your circulation or balance can lead to bigger problems down the line. So, what can you do about it? Thankfully, the solution isn't about removing your quiet moments, it's about relocating them and being more mindful of your time on the toilet. Here are some practical strategies. Limit bathroom time to 5 to 10 minutes max. Make it a habit to be efficient. Do what you need to do and then move to a different chair or setting if you want to rest or reflect. Bathrooms aren't designed for long-term sitting. Avoid reading or using your phone while seated. This is a major reason people lose track of time. Instead, bring your book or device to a comfortable chair or sofa. Give your body a break from the posture and pressure of the toilet seat. Use a timer if necessary. Set a soft alarm to help remind yourself when 10 minutes have passed. This gentle cue helps create new habits without feeling rushed or panicked. Be mindful when standing up. After sitting for several minutes, take your time when getting up. Sit up straight first, take a breath, then rise slowly. This reduces your risk of dizziness or a sudden drop in blood pressure. Exercise to improve circulation. The better your blood flow, the less vulnerable you are to the side effects of long sitting periods. Gentle walking, ankle rolls, and leg lifts throughout the day can make a surprising difference. Talk to your doctor if you notice dizziness or fatigue. These could be signs of underlying blood pressure or heart issues that should be monitored more closely. And perhaps the most important shift of all, reframe how you think about your time in the bathroom. Instead of using it as your only escape, look for other safe and supportive ways to decompress. Set aside 10 minutes in your favorite chair by the window. Brew a calming cup of tea. Step outside for fresh air. These moments of peace are just as valuable, but far less risky. At this stage of life, your daily rhythms matter more than ever. Tiny decisions add up. Where you sit, how long you stay, whether you listen to your body or tune it out. All of these are choices. And every choice is a step either toward health or away from it. So be gentle with yourself. Enjoy your routines. But never forget, even something as simple as how long you sit in the bathroom can quietly affect your brain, your balance, and your long-term health. Make your quiet time count without putting your health on the line. 3. Showering in very hot water, a comforting habit that quietly raises stroke risk. There's something soothing about a long, hot shower, especially as we age. The warmth relaxes our muscles, eases joint stiffness, and gives us a moment of solitude. For many older adults, it's one of the few daily rituals that feels truly indulgent. But beneath that comfort lies a risk most people never consider. Showering in very hot water can quietly contribute to stroke risk, especially for those over 60 with existing health concerns. Let's explore why this matters and what you can do about it. When you step into a hot shower, your body responds almost immediately. The heat causes your blood vessels to dilate, a process known as vasodilation. This widening of the blood vessels can lead to a temporary drop in blood pressure, especially if the heat is intense or the duration is long. For someone young and healthy, the body compensates quickly. But for older adults, particularly those with a history of high blood pressure, cardiovascular disease, or circulation issues, the effects can be more pronounced and dangerous. In fact, the sudden drop in blood pressure caused by hot water exposure can make you feel dizzy, weak, or even lightheaded. And when the brain doesn't receive enough blood flow during this moment, it increases the risk of a transient ischemic attack, TIA, or even a full-blown stroke, especially if other risk factors are present. This risk isn't just theoretical, it's backed by research. Studies from countries with high rates of hot bathing like Japan and Korea have shown a clear correlation between extremely hot showers or baths and sudden cardiovascular events, particularly in seniors. One report noted that incidents of stroke and cardiac arrest were more likely to occur within an hour after a hot bath, especially in colder months when the contrast between body temperature and room temperature is greater. There's another hidden danger too: thermal shock. When you leave a hot shower and step into a cooler room, especially a drafty bathroom, the rapid shift in temperature can cause your blood vessels to constrict suddenly, creating a spike in blood pressure. This kind of sharp fluctuation can stress the cardiovascular system and, in vulnerable individuals, trigger a stroke or heart issue. So what starts as a relaxing ritual can become a risky one, unless you adjust it mindfully. Here's what you can do to stay safe without giving up your comfort. Lower the water temperature slightly. You don't need to take cold showers, but instead of turning the tap all the way to hot, aim for warm to moderately hot, enough to soothe your muscles without overwhelming your circulatory system. If your skin turns red or you feel flushed or short of breath, the water is likely too hot. Limit shower time to 10 to 15 minutes. Prolonged exposure increases vasodilation and heat buildup. Shorter showers reduce the stress on your system while still offering the benefits of warmth and relaxation. Warm the bathroom beforehand. Stepping out of a hot shower into a cold room is one of the biggest risks. Use a small space heater, safely placed and monitored, or run the shower briefly to steam up the room before you begin. Keeping the environment warm prevents drastic temperature swings. Sit down when needed. If you've ever felt a bit dizzy while showering, you're not alone. Consider using a shower chair or stool. These allow you to stay safe while still enjoying your routine, especially if your balance isn't what it used to be. Avoid showering right after waking up or eating. These are times when your blood pressure is already fluctuating naturally. Give your body time to stabilize before stepping into a warm shower. Be mindful of signs like dizziness, nausea, or headaches. If you feel any of these symptoms during or after your shower, stop immediately, sit down, and rest. These can be early warnings that your body is under strain. Stay hydrated before and after. Hot showers can dehydrate you more than you might think. Drink a glass of water before and after to support circulation and overall stability. Remember, comfort and safety can go hand in hand. You don't have to sacrifice your daily moments of calm, but you do have to adjust them in ways that honor your body's changing needs. As we age, we learn to listen more closely to the creaks in our knees, the rhythms of our breath, the whispers of our heart. Your body tells you what it needs, but it also tells you what it can no longer handle without a cost. Hot water is healing. It brings peace, but like any good thing, it needs to be used wisely. So the next time you reach for the shower knob, take a moment. Check the water. Breathe slowly. Keep your routine, but make it safer. Because protecting your brain, your balance, and your future begins with the simple choices you make every single day. 4. Ignoring sudden bathroom dizziness or head pressure. A silent signal that should never be overlooked. Sometimes it's just a few seconds. A strange feeling as you rise from the toilet, a rush of blood to the head, a moment where your balance wavers or the room feels like it shifts ever so slightly. You shake it off. Sit down for a moment. Tell yourself, I just stood up too fast. But here's the truth. Those brief moments of dizziness, head pressure, or confusion in the bathroom could be silent alarms, your body's way of warning you that something far more serious is happening beneath the surface. And ignoring them could raise your risk of stroke dramatically. Let's take a closer look. When you're in the bathroom, whether you've been sitting on the toilet, stepping out of a hot shower, or simply changing position, your blood pressure naturally shifts. But as we age, the body's ability to regulate these shifts becomes less efficient. That means transitions like standing up quickly or bending over can lead to orthostatic hypotension, a sudden drop in blood pressure that briefly deprives the brain of oxygen-rich blood. The result? That head rush. That wobbly moment. That pressure behind the eyes. Sometimes even a sudden sense of exhaustion or burst of nausea. But here's where things get dangerous. These sensations are not just annoyances. They are often early warning signs of cerebrovascular strain, especially in those with underlying conditions like hypertension, diabetes, atherosclerosis, or past transient ischemic attacks. In other words, that funny feeling you keep brushing off could be your brain struggling to maintain blood flow. And that's not something to take lightly. Even more concerning, the bathroom is one of the most common places where strokes begin, according to emergency medical data. Why? Because of the combination of heat from showers or baths, sudden changes in posture, straining during bowel movements, dehydration, and the body's natural early morning blood pressure surge. Together, these factors create the perfect storm for a vascular event, especially in older adults. Now here's the important part. You don't need to panic, but you do need to pay attention. Many strokes don't come on with fireworks or sirens. They begin subtly. A few seconds of confusion, a wave of dizziness, a change in vision, a sudden headache. And the bathroom, where most people are alone and in a relaxed state, is where these signs are often missed or dismissed. So how do you know what's normal and what's not? Here are red flags you should never ignore, especially if they happen in or after a bathroom visit. Sudden dizziness or lightheadedness when standing up or after a bowel movement. Head pressure that feels unusual or comes on abruptly. Blurred or double vision. Numbness or weakness, especially on one side of the body or face. Slurred speech or trouble finding the right words. Loss of balance or coordination. A severe, unexplained headache. Even if these symptoms last only a minute or two, they must be taken seriously. They may indicate a transient ischemic attack, TA, also called a mini-stroke. And TAs are not harmless, they are powerful predictors of future full strokes. In fact, up to 1/3 of people who have a TA will experience a major stroke within a year if no action is taken. But there is good news. Acting quickly can save your brain, your independence, and your life. Here's what you can do right now to stay ahead of stroke risks in the bathroom. Don't rush. Whether you're standing up from the toilet or getting out of the shower, take your time. Sit for a moment, place your hands on your knees, and stand up slowly. Let your body catch up before moving. Stay hydrated. Even mild dehydration makes you more prone to dizziness and low blood pressure. Start your day with a glass of water, especially before a hot shower or taking medications. Know the signs of a stroke. Use the FAST method. Face drooping, arm weakness, speech difficulty. Time to call emergency services. Keep a phone in or near the bathroom. In case of an emergency, make sure you can call for help. A waterproof phone case or a medical alert button can be a literal lifesaver. Tell someone if you experience episodes of dizziness. Don't keep it to yourself. These events are critical clues. Talk to your doctor. Get your blood pressure checked, especially if the symptoms are frequent. Track patterns. Keep a simple notebook near the bathroom or use a phone app. Record the time, intensity, and situation of any unusual episodes. This data is invaluable for your healthcare provider. Avoid getting overheated. Combine warm, not hot, water with proper ventilation to avoid spikes or drops in temperature-related blood pressure changes. The bathroom is a place of vulnerability, but it can also be a place of power. A place where awareness begins. Where you take stock of how your body feels. Where you learn to listen to those subtle signals before they become something more serious. If this video helped you or someone you love, please take a moment to click like and subscribe to my Reboot. We're building a community where aging is not something to fear, but a journey to be honored, empowered, and lived fully.